Hello everyone and welcome to our Shared Stories series. My name is Tracy Goodman and I'm the Patient Services Coordinator for the AF Association. Sharing Stories provides additional comfort and support to those patients who are dealing with the same situation. So here today we have got Derek. Derek has very kindly offered to share his AF journey with us today. Okay, so hello Derek.
Hello there.
So can I ask you a question? The first one I'd like to ask you is, when were you first diagnosed with AF?
Yes, I first had AF in 2014, following a coronary artery bypass graft, a procedure that I needed when I was struggling with chest pains, I guess, following a holiday. And on days, I had a bypass graft, a double heart bypass graft at the Heart Hospital in London. And on day 3 of that recovery period, I went into AF for the first time. Not that I knew what it was about. I was clearly in intensive care at that time. It was treated with amiodarone initially, things went quite well in my recovery period, such that I had paroxysmal AF. That means it comes and goes and is rather unpredictable, about once a month or so. So initially it started off following the operation and then actually got progressively worse over a period of about 6 years.
Okay, thank you. So how was the diagnosis changed your life at all? Has it affected you in any way?
Well, it has. It has in 2 ways, I guess. Physically, having AF, and most people who do have AF will be able to confirm this. For those people that do know they've got AF, I suppose some people don't know that they're actually in AF. I certainly perceive AF very well, very explicitly. It's like a thump, bump, thump, bump, bump, bump in my heart, especially if you're in bed, you hear it. It lasts for me about between 18 and 24 hours before I go back into sinus rhythm. During this time, I get headaches. I feel generally very fatigued. I can't do very much. I just sit, read, or whatever. If you do any type of exertion, if you actually want to climb the stairs or do anything like that, you get short of breath. It is sometimes quite alarming and clearly does change your lifestyle for that period when you have it. The other problem is that it's unpredictable, or I think mostly unpredictable. I'll perhaps talk about triggers a bit later. But it's the worry, the psychological worry that is the AF going to turn into fast AF? There are psychological pressures which in the back of your mind gnaw away. You know you're not very well. You want this thing AF to go and you don't know when it's going to come again. So there are 2 things, physical problems and for me anyway, and clearly some psychological problems as well, which you have to get a grip of. And in the passage of 6 years, I've become much less bothered by a period of AF, although everyone is very uncomfortable and you know you're dying for that moment when, or that period when sinus rhythm is recovered and you feel immediately as if a weight's been lifted off your body. So yes, it does have quite challenging effects on the way you perceive it and the way you live your life.
Thank you, Derek. That's very well explained, actually. That's really useful for everybody that watches this to know that information. So you mentioned about being worried about it and things. What treatment options did you take?
Yes, I mean, I must say, I've had the most amazing service from the NHS. My cardiologist has been absolutely amazing. And I've had 2 or 3 sessions with him at not frequent intervals. Obviously, one has to wait your turn. They've given very good advice. I had amiodarone initially, which I think the medical profession don't like to keep you on for too long. It's quite a powerful drug. I immediately went on to bisoprolol, which was quite helpful in limiting the rate of your heartbeat and whatever. And I think it was quite effective for perhaps a year or so. But the frequency of my AF the frequency increased quite alarmingly from perhaps once a month, once a month, to once a week. To latterly, every time I went out, and I've been pretty active. I play golf many times a week. I cycle. It hasn't kind of restricted me unless I actually have an AF bout when I can't do anything at all. But it did get quite frequent, and my cardiologist put me on to sotalol for a period of time. That has an effect of adjusting the arrhythmia and the rate. It does two things, it would seem, and that was quite useful. That took over from bisoprolol. Latterly, though, that was changed again back to bisoprolol and flecainide, which seems to be now the drug of choice for many cardiologists. And I must say that really was as effective as anything else. It reduced the occurrence from about every time I went out to play golf to something like once a fortnight. So it did have a really important effect and a very useful effect. Having said that, I still had it. I was still bothered by it. And a very good session with the cardiologist decided that an ablation with an electrocardiologist, actually, I was referred to an electrocardiologist at Barts, who suggested that it was time for an ablation. I got the distinct impression that AF begets AF. The more you have it, the more you get it, it seems. And I was worried. I'd had it for 6 years. You know, I didn't want it to become permanent AF, because I think that is slightly more difficult to treat. So the last port of call was an ablation, which I had as a day case. I went in the morning, came out. It was not pleasant, but it was perfectly capable. You know, you were able to deal with it quite easily. And I'm in 10 weeks post the ablation, the cryoablation, using temperature cooling to cauterize event, I suppose, or scar around the 4 pulmonary arteries in the left atrium, where these stray electrical impulses seem to leak into the heart and cause all the problems. And I must say, I mean, touch wood, 10 weeks, I do not have AF anymore. So it's a miracle. I can't believe that such advanced technology in terms of cardiac surgery can be so effective. So I think the ablation for me, I'm hoping has solved a problem that was really beginning to affect my lifestyle, the way I led my life, and affected the things I wanted to do.
So it sounds as though you put your faith into your cardiologist, and they guided you through various medications to find the right one that was right for you, because obviously everybody's different. And then they recommended the ablation, which you took their advice and you followed through, and it actually sounds as though it's working, which is a good thing. It's a very good to put out there.
Absolutely. I'd done quite a lot of research actually on the web. I'm the type of person who wants to know what's going on, and I've researched into lots of things to do with AF. And I must admit the procedures seem to be a bit scary, but I think it's a very commonly carried out procedure now. And although the success rate isn't 100%, I think in my case they warned me it might take 2 sessions for it to be effective. I think the first, if you have an ablation, 60 to 70% of patients come through and it works. If you have a second one, I think the chances go up to about 90%. So it's a fantastic procedure that is just, I mean, life-changing. I can't kind of praise the people that went through this development period to get this thing up and running. I mean, quite remarkable technology.
So that's really good that you've recommended it for people that maybe haven't had one or apprehensive about being requested to have one. So you would certainly recommend it.
I think I would. I think everyone's individual, and your cardiologist will clearly guide you. But I think that most people that have certainly paroxysmal AF, it's probably the first port of call after the drugs seem to be not so effective. I think I think the drugs have got to be given a chance, and sometimes they're very successful and can put an end to AF. But I think when the frequency goes up and it's not being sorted, it's clearly a very, very important option, and I would highly recommend it. Yes, I really would.
Wonderful. So when you were going through the episodes of AF, you mentioned that you felt very fatigued and things like that. What lifestyle changes did you have to make at that time? And so on the other side of the ablation, how has it affected your lifestyle now?
Yeah. Well, I did have to make quite a lot of lifestyle changes. I mean, you were never sure whether you were going to get this AF. You know, if I'd arranged to do something on Wednesday and on Tuesday I'd be playing golf, would I have AF, and could I make the whatever I was doing on Wednesday work? So you had to kind of always in the back of your mind think ahead, and it was always a slight problem in the making, I guess. My lifestyle changes, though, I did try and identify what triggered my AF events. And I went through a period of wanting the answers. Was it X, Y, or Z? And if I could get rid of those, I'm sure I could get rid of this AF. In fact, my first AF bout, or one that I remember, was at a wedding after I'd had a few too many drinks, I guess. Not too many, but I'd had more than I normally have. And the effect of alcohol, so I'm almost sure, triggered the process of AF, which was quite alarming. I also had AF after a couple of strong coffees in the morning. I'd played tennis without having much hydration in the morning. It was in Portugal, and I had a couple of coffees at mid-morning, and immediately after that I went into AF with quite a high heart rate, and that was quite worrying. Dark chocolate, I think does trigger, for me, AF. It must be the caffeine content or something in chocolate, which exertion, I've already said. Exertion for me, I know my limitations. So if I go beyond that, if I played golf 2 days in a row, I would almost certainly get AF on the third day or at the end of the second day of playing golf. Dehydration, I think, is really important. I was quite paranoid about drinking. I had this kind of idea that your kind of salt balance in the cells, I'd read quite a lot about salt balances. So I was always well hydrated. And I think that was very useful, but it didn't obviously avoid AF at all times. So yes, I did have to make some lifestyle changes. And the most important ones, you know, no alcohol, no coffee, not much exertion, lots of water.
Of course. What advice would you give to somebody that's newly diagnosed with AF?
I did, though, worry about what AF meant, and I was paranoid to begin with. The first event at AF, I remember I went to A&E. I thought, my goodness, I need this dealing with. My resting heart rate was about 50, and it used to go up to about 80 odd when I had my paroxysmal AF. I thought it was the end of my heart was going to pack up and I was going to die, really. You clearly get over that after a few events, and you realize your heart isn't going to pack up. It's a pretty robust organ. So I started not to worry quite so much after a period of time. But nevertheless, I would say to people, really, don't worry. There are lots of things you can do. Medically, you've got to listen to your cardiologist. I think some lifestyle changes are necessary, and you might find that something does trigger it. After all the drugs kind of seem to not work, and sometimes they do, then there's always ablation. And I think they're getting so good at doing all sorts of very sophisticated ablations for all sorts of AF types, really. So I would say that, there's every chance you can recover from this and really go back to some kind of normality. You've got to stick with it and not be too preoccupied by it if you can. Not easier said than done, I think.
That is great advice, Derek. That's very good advice. How has the AF Association helped you?
Well, yeah, after the ablation, I had a couple of symptoms which were slightly worrying. I had a migraine, migraine aura, I think they call it, and I had trouble with my indigestion. I felt that I couldn't eat much really, and I did get slightly worried, particularly with the migraine aura. I actually thought I was having a stroke, which is a very slight possibility after an ablation with blood clots and whatever. They monitor it very carefully when you're during the procedure, but there is a slight problem, a possibility of it. And on the web, I dialed in migraine aura or post-ablation problems or something like that. I was really struggling with this aura. It was the worst headache I'd ever had. And lo and behold, the AF Association comes up and there's a series of fact sheets, and I went through them, and there was one post-ablation or ablation, and I read it avidly, and there in about paragraph 8 was, don't worry about migraine aura. A couple of days after ablation, they sometimes occur. And even in the text, it said, you're not having a stroke, relax. And they were very helpful too about the indigestion problem. It's a possible problem with the esophagus that gets disturbed a bit through when the cryoablation is applied. So here was my savior. This fact sheet told me that these are symptoms which do occur. And I was thoroughly impressed with the kind of directness of it, the style, the language. In fact, I have to say that all the information I've been given at my hospitals that I've been to about ablations were inadequate in comparison to the AFA stuff. Now, I'm not just doing that as an advert for AFA, but I have been thoroughly impressed with the organisation, and not just on AF. There's every subject to do with atrial arrhythmias going. So I think it's a great organisation, and that's why I've offered to perhaps tell my story in the hope that perhaps somebody might feel some things in common. I know we're all different, but this is my story, and as far as I'm concerned, it's a great story of being saved. I mean, when I had my heart bypass, the next stage was heart attacks and death, and now I live a pretty fit life, and I cycle and I play golf, and life's great.
That's great. I'm so pleased that you've shared your journey with us today, Derek. You've highlighted great praise for your cardiologist and for the procedures and the treatments that you've received. So it's really good message for everybody that not to worry about things, to get things sorted and take their advice. That's wonderful. Thank you very much, Derek. That's very much appreciated.
Not at all, a pleasure.
Okay, you take care.
Thank you.